Hi, I'm Dr. Jenny Emerson. Cracked teeth are more common the older we get. In fact, they're the #1 reason we lose teeth as we age. So knowing how to control the cracks internally and on the outside of the tooth is very important. Chewing ice is very harmful for teeth. The thermal coefficient of that ice on the hard tooth structure causes expansion and contraction and causes the cracks to multiply down that tooth. There are a lot of ways to address this. In some cases, we may poke a hole into that tooth and follow that crack, put a little filling in there, and bond that tooth together. Oftentimes that crack goes a bit deeper, and so that kind of a hole poked into that tooth weakens the tooth structure. So the more appropriate focus for controlling cracks is doing onlays or crowns on teeth. An onlay covers that tooth in its entirety and prevents the structure of that tooth to split like a wedge if you do have a filling inside that tooth. So the takeaway for you is that less is more. Bite guards, avoiding clenching, controlling the bite forces before starting to cut into the tooth is maybe the more conservative and long-term approach before we cause the fractures to really break through the entirety of the tooth catastrophically. The other takeaway of the message is putting an overlay or a crown on top of that tooth, or a veneer if the cracks are in the front, is actually providing strength to that tooth long term. If you have a crack in your tooth and you're starting to feel sensitivity, be sure to let your dentist know.